We're back with the Hall Institute Forum, and we're talking today with David Knowlton about the question of health care. David, this has become the outstanding domestic issue in the presidential campaign. Everyone's talking about health care, about prior conditions, which people never talked about before. They're talking very much about the question of the number of uninsured, which you've dealt with throughout the country. And I'm sort of curious at your thought. Do you sit down and listen to these people and say, my gosh, this really is old news. Where have you been?
A little bit, that's true, for a couple of reasons. Number one, the candidates are catching up to where New Jersey's already been. New Jersey has had guaranteed issue health insurance for a long time. It's protected in our individual and small group markets. Now, there's some problems with those markets now, but we've had it for some time. And I think the second thing is it's very hard to run something on a federal level in a national campaign. If any of the national candidates got their way and were able to implement their ideas, it would be a long time before they were actually implemented. I believe in the states as the laboratory of democracy. I think that we are the place that real change will take place. So I'm pleased that New Jersey's going forward.
Okay, well, going back, talking about the states, just recently, I believe it was on St. Patrick's Day, as a matter of fact, Senator Joseph Vitale introduced a proposal for universal health care coverage in New Jersey, which was news to a lot of people, but I know you were working on it for about 2 years prior to that with the senator, and I wonder if you would be kind enough just to maybe give us an overview of that proposal, and then we can talk about it in more detail.
Sure. Senator Vitale came to me about 2 years ago and said, would I help him put together this concept? And I said I would, but I said I had three conditions. I said it had to be transformational. It had to be big. In healthcare, if you just change one thing, it's like a balloon. You squeeze it here, it goes over there. So it had to be transformational. The second term was that I got to pick the working group, the team myself. And the third was that he attend every meeting, which was no small order because we met about 2.5 hours every single week for a whole summer and into the fall. So it was a pretty aggressive agenda. The concept is really easy to understand. If you want to take care of health care, you've got to do three things. You've got to ensure that all of those who are entitled to some sort of federal or state program get into that program. The second thing you've got to do is you've got to ensure that everybody who is not in those programs is who has small business coverage or employer-based coverage can keep that coverage, that it's affordable for the small employer. And then you've got to design a plan for everybody else. And in New Jersey, there are 1.3 million uninsured. But 300,000 of those uninsured are people who are not in programs but are entitled to be. And you get federal match for that, 50-50 in Medicaid and 65-35 in SCHIP, which is the program for children called Family Care. Then the next step down is 400,000 of them are undocumented residents that you can't put into an entitlement program. The remaining 614,000 are the uninsured, and that's the ones that you can address. So we're creating a large plan that will be state-sponsored, self-insured, state-administered, that will take care of those remaining uninsured. And we're expanding SCHIP and Medicaid to accommodate the others. The problem becomes then we can now take money that we allocated to charity care, which we have in New Jersey, which provides for care in an emergency room or a hospital, and redirect it to providing premiums so people can get their coverage. The real key to this program is we said it had to have 4 pillars to hold it up. The first is it had to be universal and portable. It had to apply to everyone, and it had to mean that when you lost your job, it went with you. You could take it with you. The second is that it had to be affordable and sustainable, not only for you, but for the government. You had to be able to afford it. You had to be able to afford it over time. Very often, insurance programs, you can afford it in year 1, but you can't afford it in year 2. And the third thing is that it had to be commercial grade. If I'm going to ask you to have health insurance, you're not going to want to have Medicaid. You're going to want to have something that is robust. And finally, we believe it has to be mandated, a requirement that you have to have health insurance. Very similar to you have to have auto insurance. You can't get a mortgage on your home if you don't have homeowners insurance. Well, we believe you have to have health insurance. Because what happens is we squeeze out of the system young people who say, well, I don't need it. I'm not pregnant. I'm not sick. I don't own any property, so I don't have to worry about my health insurance right now. I'll wait for a few years. There's no pressure on the labor market, but if you require everybody to have it, then there's pressure on the labor market, and we think they'll get it. So in a nutshell, it's a very complicated plan, but in a nutshell, that's how we designed it, and that's what it looks like.
Okay, can you just maybe address some of the economic points? Because the governor's reaction, I think, was representative of what a lot of people felt. He said, no issue was, closer to my heart. I understand this is important, but given the fiscal condition of the state right now, should we be embarking on a program like this?
Well, I'm pleased that Governor Corzine has agreed now to back this idea, and he's done it publicly, and he's been very supportive now. He had to think about it. But our point to him was very straightforward. Governor, you're paying this money already. We're paying $719,000 in charity care, $250,000 in hospital supplements. The cost of this program is less than $1 billion. So you're in the same exact range. You're just shifting the money from spending it one way to spending it another way. That's all it is. And the real issue is, how do we transition? The money that is going to be required is transitioning from System A to System B. I call it the brake and the accelerator. How do you slow one program down while you're accelerating the other program? Mm-hmm. And that's going to take some time and will require some money. And the governor is pledged with Senator Vitale to look for that money. He believes this is very important. Okay. But that's the point is well taken. Right. That's the state's fiscal crisis, of course.
Very good. We'll come back. We'll break for a moment.